Good afternoon, everyone. We'll be beginning in just a moment. Good afternoon, everyone. Let's go ahead and get started. Welcome to the webinar of the National Governors Association, the Office of Child Care within the Department of Health and Human Services, and the Bipartisan Policy Center. We are very pleased to have you joining us all today. And I would like to introduce myself first. I'm Beth Karen. I'm the director for the Education Division within the National Governors Association Center for Best Practices. We're pleased to have you on this call. I'll go over the agenda briefly, and then I'll give you a few housekeeping instructions before we get underway. Today on our call, we're very pleased to welcome Lynn Johnson, who is the Assistant Secretary at the Administration for Children and Families at HHS, and Shannon Christian, the Director of the Office of Child Care at ACF. They are also joined by their ACF colleagues, Dawn Ramsberg and Rachel McKinnon, as well as Anna Pilato, the Senior Advisor for External Affairs, Greg Hunt and Lee Stevens from the Intergovernmental Affairs, and the Chief of Staff, Brad Wasink. We are also joined on the call today by Linda Smith, Director of the Early Childhood section at the Bipartisan Policy Center. Linda will be discussing financial supports for childcare, including paycheck protections, small business loans, unemployment benefits, and paid family leave. We'll talk a little more about what we'll hear from the Office of Child Care in a moment, but before we go into that, I want to just give everyone a few of the specifics around the housekeeping for this call. First, this webinar will be recorded, so we will share this out with you afterwards. As soon as we can, we will pull that together and send it out. All of your lines have been muted to minimize background noise. But we'd like to welcome you to add your questions and comments into the Q&A box throughout the call. We've saved time at the end of the call to go over those questions. So please take a look at the bottom of your screen, and you might need to pull it up. Sometimes if you hover down at the bottom of your screen, it will pop up. There's a Q&A box. So please put your questions and answers in there. We prefer you use that rather than the chat box because it lets us organize the questions and capture them afterwards if we don't get a chance to answer them all. So if you have a question and it gets answered, it'll move over to the answer tab so you can see your question answered live if someone has an answer that they can deliver immediately. So let me go ahead and move us into the content of our session this afternoon. I'm pleased to be able to welcome Lynn Johnson, who will be talking to us briefly about the value and the reasons for this, this important webinar today. There are a lot of important issues that need to be addressed, and we know a lot of you are interested and concerned with how to help and support the child care communities within your states. So with that, let me see if we've got Lynn's sound on before we jump in. We always are going to have a few little tech things that we have to think about in here. I see her in the room, but I don't see her audio. Lynn, can you hear us?
I can hear you, but I don't think you can hear me.
We can, in fact, hear you. So wonderful. Okay, with that, you don't show up with having a microphone, so it's just the magic of the technology. So it's my pleasure to introduce you, Lynn, so I'll let you take it away.
Can you hear me now?
Yes, we can.
Okay, great. Thank you. And it is so great to be working with you at NGA to discuss what we're doing and to move forward in such a positive way. I am hearing things all throughout the country, positive things that governors are doing, concerns that childcare workers are having, need for essential workers to be able to find childcare. So this call is very, very critical. And we also will report that the $3.5 billion that we received to assist with childcare should be out and to the field by next week. And with that, I'll just say thank you again, and thank you, Beth, for coordinating this call, and for APHSA for supporting the work that we're doing. I appreciate all of you. Thank you.
Thank you, Lynn. Now it's my pleasure to introduce Shannon Christian, who's the Director of the Office of Child Care at ACF. And as I mentioned, Shannon is on the phone with Dawn Ransberg and Rachel McKinnon, who will be also going over the flexibilities that are available to states underneath the Child Care and Development Fund. So with that, let me turn it over to Shannon.
Thank you, Beth, and good afternoon, everyone. I also appreciate you making time for this call. Our goal in the next 30 minutes is to familiarize those of you with oversight or partnering responsibilities for childcare in your state with the CCDF flexibilities and opportunities in our Child Care and Development Fund law and regulation and supplemental appropriation that we've been discussing with your state child care administrators for the last couple of weeks. A bit later, we'll do some Q&A and learn more about your perspective. Before we jump in, though, I just want to say a word or two about the Child Care and Development Fund. Our office, the Office of Child Care, administers that. It is an $8.7 billion block grant to states, territories, and tribal governments with the additional match MOE and TANF transfer, about $11.7 billion. In addition, as Lynn mentioned, the CARES Act enacted in March 27th provided $3.5 billion in supplemental CCDF funds to help state, territory, and tribal lead agencies address the COVID-19 impacts. It's very flexible funding, and they're focused on two big goals. First is to assist with childcare for emergency or essential workers, and second, to help maintain childcare businesses and staff so they will be there for the nation's working families when this crisis is over. So we'll jump in. We're taking turns in this presentation, so you'll hear from Don and Rachel and me interspersed in the different slides. So we can start with the government's role in COVID-19. Sometimes it seems important to separate out what the feds are doing from what is state or local responsibility. So the very simplistic view is that at the federal side, the CDC, the Center for Disease Control, does the resources and guidance on public health concerns. And then our office, OCC, does the program and policy administration and oversight of the Child Care and Development Fund. And then Congress does the funding and governing legislation with the okay from the President's office. Then on the local side or state side, you've got the local public health agencies that are tracking and making decisions at the local level around this disease and what steps are going to be taken to protect people. Then you've got the state overseeing the CCDF policy and the funds that we provide in making the statewide decisions within that broad flexibility of that law. And then oftentimes some of that has to go through this, the state legislature for additional funding or for certain kinds of rules that are the state's choice with how they implement CCDF. Next slide. Okay, the federal health, public health resources that I want to draw your attention to are, there's a coronavirus.gov. There are other ways to get in there, but there's that shortcut. And that has the up-to-date information about prevention and symptoms and testing. Then there is a, you know, my screen's jumping around. All I can see is that chat box. I'm going to do my own slides over here. CDC issued guidance to help administrators of public and private childcare programs and K-12 schools to prevent the spread of the disease among children and staff. That was very, very general, but it was all that was out for a while. But then about 2 weeks ago, they put out supplemental guidance on childcare in particular, and both our office and the Office of Head Start worked closely with the CDC team to make sure it was addressing the biggest problems that we were hearing about. And I did hear that tomorrow there's a little more clarification and guidance coming out from them. Next slide. So then the next slide is our resources. So what we did was we've been pulling all of our materials together in one place on our acfhhs.gov OCC. You can see that in the lower left website link. And with that, we have guidance on the existing flexibility in our law and ways that you can respond to the emergency situations, and then an old memorandum that was in place for general emergencies, as well as now a lot of new material about this particular emergency. And then, so those are the things you can find there. And we will be constantly updating the FAQs, the frequently asked questions, as we attend events like this and hear more and more specific questions that we need to answer. Next slide. So this is a little elaboration on what Lynn Johnson already mentioned, but the types of things we've been hearing about are the importance of maintaining the childcare revenue during closures and service reductions so that we retain the childcare supply for the programs and the staff, the businesses and the people who work there, that we need to continue to provide childcare services to existing families as needed and to new families, regardless of their current status. And those might be the health workers and emergency responders or parents who are working while the schools are closed, and that we need to keep children healthy and consider setting practices that prevent the spread of COVID-19. So those are that a lot more, but those are the recurrent themes. Next slide. Okay, and we'll turn it over to Rachel from the Policy Office.
Thank you, Shannon. This is Rachel. Can everybody hear me?
Yep.
Great, thank you. So I wanted to talk to you all about the Coronavirus Aid, Relief, and Economic Security Act, or what is also called the CARES Act. So the CARES Act was enacted on March 27th, 2020, and provides $3.5 billion to state, territory, and tribal lead agencies that administer CCDF programs. So not only does the CARES Act provide additional resources for CCDF programs, but it also introduced additional flexibilities. And as Shannon said, a lot of these flexibilities are around the importance of maintaining and reopening child care providers. So under the CARES Act, funds can be used to continue payments and assistance to child care providers in the case of decreased enrollment or closure. So this could go to continue to supplement child care providers who have had to decrease their enrollment because children have been pulled out, or to continue to pay staff when a child care provider has closed. So our standard CCDF requirements include an income eligibility level of 85% of SMI. So oftentimes states will have income eligibility thresholds that are below that, but in general, most families who are receiving CCDF subsidies are earning 85% or lower of state median income. What the CARES Act does is make the child care assistance available to healthcare workers, emergency responders, and other essential workers, but without regard to the income eligibility requirements. So this means that essential workers that have been deemed essential by public, state, or local public officials can be earning more than the 85% of state SMI, which is our federal threshold. Next slide. So the CARES Act also provides for cleaning and sanitation and other activities necessary to maintain or resume the operation of programs due to the coronavirus. So these can be pretty specific examples, such as paying for cleaning supplies or for deep cleaning services. But this also opens these activities to providing double payments to providers in the situations where one provider has closed their doors, and so they may continue to receive payments to hold that child's slot at the child care provider, while that child is also receiving emergency child care provider from another provider. And the CARES Act also makes these funds available to CCDF providers, even if they hadn't been receiving CCDF funds prior to the public health emergency. In addition to paying for coronavirus-related activities, these CARES Act funds can also be used for just the standard day-to-day CCDF program activities. So under standard CCDF law, lead agencies are required to spend a significant portion of their funds on direct services. They are also required to spend 9% of their funds on quality activities, an additional 3% of funds on quality activities specifically targeting infants and toddlers. So for funds received under the CARES Act, these requirements are no longer required. So this frees up states to be able to spend the money to support their child care providers, their essential workers, and their children and families in a way that makes the most sense for them, whether that be through increasing their direct services to children and families or increasing their quality activities. And finally, lead agencies have until the end of federal fiscal year 2022 to obligate the funds from the CARES Act, and then another year to liquidate the funds from the CARES Act. So Dawn is going to go on to talk about the flexibilities that exist within our standard CCDF requirements. But as she goes through them, we highlight a little the areas that are, or the topics that are affected by the CARES Act. So as she goes through the following slides, you'll see the areas that are in this red font highlight the flexibilities that are added through the CARES Act. And with that, we can move to the next slide, and I will turn it over to Dawn.
Thanks, Rachel. Can someone confirm that they can hear me before I move on?
I can hear you, Dawn.
Great, thank you. All right, so as Rachel said, I'm going to talk about the flexibilities in CCDF, and some of those flexibilities were already there, and some of those were added by the CARES Act. The key thing with the flexibilities is with the existing flexibilities or with the CARES flexibilities, we understand that some state action may need to be taken, whether that be through legislation, regulation, or through some executive orders or administrative activities. And so on our end, it may mean that there will need to be an amendment to the CCDF plan, which is what the states, territories, and tribes submit to us to apply and receive the funds. And so we ask that each state, territory, or tribe to contact the regional office representative for guidance prior to submitting the request. Therefore, we know if you really truly do need a waiver or if a plan amendment alone will be sufficient. And in some cases, you'll need both. So we can go to the next slide. So in terms of flexibility around the quality dollars, childcare, the CCDF quality dollars are not limited to providers who are only serving CCDF children. The quality dollars can be used to both improve/maintain quality as well as the supply of care. So the quality dollars are not limited to CCDF providers serving CCDF, therefore a waiver would not be needed, but it may need a plan amendment. And again, that's going to depend on what the state had been doing prior to the emergency. But there's a lot of flexibility to use the quality dollars beyond the program serving CCDF eligible children. We could go to the next slide. Oh, there's a little pop-up. And then as a reminder, as Rachel said, the CARES Act funds can be used for continued payments as well as assistance to providers in case that there's been a decline in enrollment or closures. And so the CARES Act money can provide that, as well as there's some flexibility under the quality dollars as well. So in terms of flexibilities and family eligibility, so changes in the family's eligibility or priority rules. So existing flexibility is states can redefine the definition of working, and they can add families who are seeking employment, participating in community service or similar activity. There's the flexibility to raise income eligibility or change what counts as income. And again, the CARES Act dollars then also are not limited to staying below the 85% of state median income. So, so there's kind of some dual flexibility there. Both there's existing flexibility under CCDF, and then the CARES Act added some additional flexibility. States lead agencies can establish new priority rules. So again, this is maybe where priority is added to children of healthcare or emergency workers or other essential workers. And again, with the traditional CCDF money, this would not have required a waiver as long as the income stayed below 85% of state median income. But with the CARES Act, a waiver also wouldn't be needed. But in both cases, an amendment would be needed to the plan to document those families who are being served with the CCDF and CARES funds. So can we go to the next slide? Another flexibility is in the definition of protective services. So again, there's a lot of flexibility as far as who can be considered in protective services. So lead agencies can modify that definition. And again, we might add the children of the healthcare workers, emergency workers, other essential families. It's not limited to child protective services only, even though it's called protective services. And again, in general, if lead agencies added this, it would allow the income eligibility to be waived for families who are receiving protective services on a case-by-case basis. But again, because the CARES Act funds can be used for families, used for essential workers without regard to income, then this wouldn't have to be done case-by-case. It could be allowed. And the protective services cases also have the flexibility to not require the parent to be working or attending training as well. So again, there's two pots of money now that offer kind of dual flexibility in different ways. So again, a waiver wouldn't be required in these situations, but it's likely or possible that a plan amendment would be, depending on how protective services is defined now and how the lead agency is wanting to change that definition to meet the needs of the families with who are needing services. So the next slide, please. Flexibilities as far as determining eligibility. So CCDF has a 12-month eligibility period. Lead agencies have the flexibility to extend that period, so it can be longer than 12 months. There's also the flexibility to lengthen the 3-month job search period, and both of those would not require a waiver, but again, would likely require a plan amendment. So lead agencies definitely can extend these periods without a waiver, but would likely need an amendment in these cases. The next slide, please. So co-pays, we've been getting a lot of questions around co-payments. So lead agencies can waive or reduce co-payments for impacted families. So families that meet a criteria established by the lead agencies, it could be reduced or waived. It would not require a waiver as long as the elimination of the copay applied only to a subpopulation. So maybe it only applied, the waiving of the copay only applied to the essential workers and not all families. In that instance, it would not need a waiver, but it would likely need a planned amendment. But if all families are having their co-pays waived, meaning no family would be asked to pay one, then in that case, it would need a waiver. So the difference is it everyone or is it a subgroup of families? Again, the sliding fee scale, as long as it is reducing the co-pays for some families, it would not require a waiver, but if it is eliminating the co-pay for all families, then it would need it. And in the cases where a waiver is not needed, there would still need to be a plan amendment. Go to the next slide. So what are the changes that would need a waiver? And again, we've updated this once the CARES Act was signed almost a couple of weeks ago. So there are policy changes under the health and safety requirements, both the standards, the training, and inspections that would likely need a waiver if states are eliminating those changes. So in terms of health and safety, if a state was not going to be conducting health and safety inspections, a waiver would be needed to allow that, since that's a requirement and there's not flexibility. It's a must do. So if you're not going to do it, and we understand why you wouldn't do it, you would need a waiver in those cases. Similarly, on health and safety training, if you're opening temporary childcare or emergency facilities and not going to have people be trained, meet certain training requirements prior to working in those facilities, you would need a waiver for that. If you're going to be, adjusting some of the health and safety requirements, meaning you're going to eliminate standards around particular topics, because CCDF has 11 topics that are required. If you're eliminating some of those topics where the programs don't have to meet those standards, you would need a waiver for that. And then background checks, again, if right now there are 8 components of background checks that need to be done, if those are going to, any of those are going to be eliminated, you would need to request a waiver on that. And then again, it would have been that if you were extending eligibility above 85% of SMI, you would have needed a waiver, but again, with the CARES Act funds, so if you use the CARES Act funds in those situations, then a waiver is not needed. And there are several states who are still in the process of coming into compliance with the CCDBG. We have been in a transition period since the Act was passed in 2014, and so we recognize there's a potential interaction with existing waivers and are trying to map out the implications of that so that we understand how to look at those non-compliances in relation to the waivers. So as the waivers have been coming in, we've been assessing the impact on existing waivers. So if we can go to the next slide. There's a couple of slides here that just talk about the process of submitting waivers. Again, we've talked to the lead agencies a couple of times about this. The bottom line is you address it to the Office of Child Care Director, but it should be submitted to the Office of Child Care, the regional office, the program manager or the regional program specialist. The CCDF allows the initial waiver period to be no more than 2 years from the date of approval. But I will just remind everyone that the waiver requests are tied to a specific emergency. So, we're not going to be looking to just broad brush give 2 years. We're going to be looking at the situation as far as determining that approval. So there's kind of what's allowed, but it needs to be specific to the emergency situation as far as how long the waivers will be. And then upon approval of the waiver request, the lead agency has 60 days to submit any associated plan amendments that need to go along. So with all of the policy changes that we talked about, in many cases, because those are also areas covered by the plan, and an amendment would need to be submitted to go along with that. And if we go to the next slide, the waiver request basically has to have 4 key elements. It needs to tell us why you need the waiver. So not just it's the COVID situation, but what's being impacted by the situation. So, in the case of background checks, we're looking to request a waiver on the fingerprinting because the fingerprinting offices are closed and providers can't go get those conducted. So we need a reason why the lead agency is requesting the waiver. We need to know, secondly, sufficient detail on which provision or provisions the lead agency is looking for the relief from. So, it's the more explicit that could be, whether it's listing CCDF regulation numbers or statutory numbers, the more specific you can be, the easier it is for us to understand the situation and be able to act on that. And along with that detail on the provision, we need to know how the relief by itself will improve the delivery of services. Third, we need the lead agency to certify and describe how the health, safety, and well-being of children served through CCDF will not be compromised as a result of the waiver. So even, again, if you're going to waive inspections or waive training, is there an alternative that you're going to look at, or how can you justify that the health and safety, are you going to do something instead to at least try to protect the health and safety of children? And then fourth, we need the preferred start date. And again, that can be retroactive to the time the emergency occurred. So we've seen where waiver requests have come in and the start date is the day the governor declared the state emergency. And so that's the start date that can be listed. And then the duration, and that can be a time period, a date if known, or it can say we're requesting this as of March 30th and it'll go until the statewide declared emergency is declared over. So that's the 4 key elements of information that we need. And I think with that, I turn this back to Shannon, and I know some questions have come in, so I'm going to take a look at those while Shannon is talking.
Thank you very much, Dawn. That was so helpful. And I am guessing right now that our audience is feeling particularly grateful that they have a Child Care and Development Fund administrator who actually understands a lot of this stuff. And I hope that if you haven't been talking with those people, that they become your new best friend. And just as a plug for our website, where we are going to be answering questions on a rolling basis. It doesn't roll real fast because it has to go through clearance after we write it, but it will be continually updated. And we have a few, I'm going to read a couple of these questions, but we also by now have a whole lot more. So first, can CCDF lead agencies continue to pay providers if childcare programs close and parents keep their children home due to COVID-19? I think you all know the answer because Dawn described it, but the answer is yes. Can a lead agency use CCDF to pay for childcare for children who are not currently CCDF eligible, and under what circumstances? So the answer is yes, and the circumstances will be spelled out. You learned a lot from Dawn just now. If COVID-19 results in increased childcare demand, can the lead agency enroll temporary unlicensed care providers to serve additional children? That's tricky, but the answer can be found on our website. Next slide. If a parent stops working or works fewer hours due to the circumstances related to COVID-19, how does that impact their eligibility for a Child Care and Development Fund subsidy? What flexibilities do lead agencies have to adjust families' co-payments if they're affected by a COVID-19 job loss? We learned that too today. How can states and their partners be strategic about which funding streams to use for each activity? There's CARES, there's the small business provisions, there's the unemployment compensation, as well as the Family First leave provisions. That's one that we're still working on the answer for, but working hard, and we will probably have some material on that at least explains the different funding streams that help you be strategic. So that's that for now, but hope you will keep an eye on our website in the updated FAQs, and our website is again listed in this slide that's up right now. So that's it for us, and I'll turn it back to Beth.
Thank you so much, Shannon and Dawn and Rachel. That was very valuable information. And as you all heard, just keep checking back on that website as more guidance goes up. HHS was fortunate in the fact that they had a lot of flexibility already in the CCDF, so they could start putting that guidance out right away. So be watching that as they update, but there's quite a bit of good information already out there. So we are going to hold on responding to your questions until the end so that we can make sure we have time to hear from Linda Smith from Bipartisan Policy Center. But also that will give a little more time for the HHS folks to look through the questions that are being asked already. Those are coming in the box, so thank you for sharing those. And if you're curious about other people's questions, if those have been answered, then you can click on the answered tab and you can actually see how they've been answered already. So keep an eye on that. And now I'm going to open up Linda's line here. So I will turn it over to Linda Smith from Bipartisan Policy Center.
Thank you, Beth. Can you hear me?
Yes, I can. Great.
It's always nice to know technology is working.
Indeed.
Well, for those of you who don't know me, my name is Linda Smith, and I am the director of the Early Childhood Initiative at the Bipartisan Policy Center. For those unfamiliar with us, we are a Washington, D.C. think tank that tries to look at, take the best ideas from both sides of the aisle to create policies that we think can solve some of the nation's critical problems. And it goes without saying that right now we have a very critical problem on our hands. I think one of the things, before I get into some of the other things, thank the administration and Shannon and her team for all of the work on implementing the CCDBG portion of the CARES Act. I know these things are difficult, having walked that walk before, and getting these things out and through coordination is never easy in the government. So I think it's thanks to everyone on that team for the work that they're doing under very difficult circumstances. I want to just talk a little bit about the childcare industry as a whole for those of you who are on the phone and may or may not totally understand. I think we have a couple of goals with what we're trying to do, both with what was in the CCDBG part of CARES as well as the other ones that I'm going to talk about. And one of those is actually to try to figure out how we can provide childcare in the interim right now to families whose parents, or to children whose parents are frontline workers. And I think that that's got to be our number one goal, and how to do that in a manner that supports the children's health and safety and the staff as well. So it's a little bit of a challenge. I think that the question that some of the other pieces of the CARES Act are trying to address are, in a nutshell, the economic viability of the child care business model across the board. We know that we have a very fragile business model in childcare, then it doesn't take long for childcare to be literally out of money. We are just going to release this afternoon, so I'm going to say a few things, sneak peek on this one. We just did a national survey of parents and what's going on with parents and their use of childcare, and trying to figure out from the parents' perspective, is their childcare still open? That we had interesting but probably common sense results to the survey that only 10% of large childcare centers are open, 16% of small centers are open, and about 28% of our family childcare homes are open. This survey was just completed this last week, so it's very fresh information. Not surprising that family childcare is probably one of the ones still operating, and in part a safe, something we need to keep going because it's smaller groups of children, and there aren't a lot of children coming and going and interacting with each other. So what is behind all of this? And I'm going to go to talk about 4 things here, and I'm not going to get into the details of these, because I think in your state, some of these things will vary in your state, but I want to talk about them in the context of what Congress was trying to do for childcare. There was discussion during the development of the legislation about whether or not some of this belonged in CCDBG, or are the childcare like other businesses, should the money be in other places? And that was quite a conversation, and there were pros and cons to that. As you will understand, the decision was made that some money be put into CCDBG, and that the childcare businesses should go compete along with others in either the small business place, or that the staff who are laid off are covered under the unemployment compensation pieces. So there's these components of this, and they all need to work together. And I think as we talk about what they are, it will hopefully become clear why it's important that we understand nationally what's going on right now. So the 4 programs are the Paycheck Protection Program, that's through the Small Business Administration. It's, I think, being fondly referred to as the 3 Ps program right now. And these are essentially forgivable loans, and that is code for a grant if certain provisions are met during the loan process. The forgivable part is what's a little bit difficult for childcare providers, because it only applies to 8 weeks. And the loan can be made for a longer period of time, but it's an 8-week period that can be forgiven. And I think that that's going to be a struggle for childcare providers, and in fact, for many of them, as I gave those statistics, that are already closed. There are provisions in this that they can reopen and then bring the staff back and then qualify, but there's a lot of questions around the community. Is that really a viable option to bring people back, open up for 8 weeks, and then lay them off again if this is not over? So I think there are questions about this. I think this is one of those areas where we need to see if this is a viable option for our child care programs. It's not a guarantee. You may have heard in the press that there's fear that the amount of money in this program is not enough. I think Congress tried this morning to increase the money set aside in this up to $600 billion, but it did not make it through. There still probably will be action on this, but at this time, it's still a fairly limited pot of money given the number of small businesses in this country. So as we look at this one, the challenges for childcare programs are, our childcare programs are going to need help in understanding this and applying for this. Is it enough funding for the programs to even stay viable? And are there any state restrictions that may impact their ability to apply? One of the things that some of the CCDBG dollars can be used for is to get help for these programs in applying for these loans. And I think that's one of the things that we're learning as we talk to states all over the country, is that they are quickly trying to develop technical assistance networks for small businesses, childcare small businesses, to apply for these loans. So depending on the size of the program, the staff they have, when they laid their staff off, when they actually closed, and a number of other things are going to be somewhat problematic in these loans, in that when people come back from when they start to how much is their revenue? How much revenue are they going to have? Are they going to be a viable program from the very beginning, or is it going to take a long time to ramp up? So there are more questions around that than we certainly have answers at this point. But again, the 3P program is something that is an option for child care programs. I think it was the intent of Congress that this be used to shore up programs during, this lapse in time. I'm pretty sure at the time people weren't expecting this to go on as long as it did, so therefore the 8-week period. So there's a lot of questions around that, and I still would encourage people to make sure that your child care providers are aware of it, and that you're providing some kind of business technical assistance through whatever vehicles you might have. Some of them might be through child care resource and referral agencies, some of the CDFIs, if you have them active in your state, the community development financial institutions. There are other options for people. The next one, and this is one that we heard this morning, is called the Economic Injury Disaster Loan Program, EIDL. And we heard this morning through some of the what was presented to Congress to consider the extensions to some of these programs, that this program, especially the $10,000 piece of this that can be approved in advance, that the money has been used up. So the question on this one will be whether or not there's more added to this as Congress moves to increase the funding in some of these areas. But this was a program where child care programs could apply for this. The $10,000 advance was just that. It was to be paid out within 3 days, and an advance, so to speak, on a larger loan amount. These were approved whether or not the providers would be approved for a bigger loan. So if they got the $10,000 and they didn't qualify for a bigger loan, they kept the $10,000. So there was quite a rush on that program, and as we understand it, that money has been sort of obligated at this point. We'll see if Congress moves to do anything further with that. At this time, though, the bigger loans, the emergency or the disaster loan piece of this is another one. Excuse me, my screen just went dark. Is another area where child care programs are going to have to be extremely careful and get really good advice on this as to whether or not these are viable loans, because there is an interest attached to these. You see the interest rates up there. For a for-profit, it's 3.75%, and for a nonprofit, 2.7, should be 2.75%. So what does that mean? Well, these loans are going to have to be repaid. They can defer the payments for a year, but at some point they're going to have the revenue coming in to cover those loans. And again, the questions that I think are on the table for childcare with this particular loan is going to be, are they sure that they are going to be able to fill their programs back up, and how soon will they fill them back up so that they have the revenue to cover the repayment costs of the loan. The next one is just a quick talk about the unemployment, and we know that this is been somewhat controversial out there. I hear when I talk to people around the country about this, well, has the unemployment piece of the CARES Act created a situation where it's more advantageous for child care teachers to stay home and not work? And this is where there's an intersection between the CCDBG money and the unemployment money, because especially when we are trying to keep providers to care for children of frontline workers, we need to think carefully about how we reimburse them. And typically in childcare, as many of you on this call know, childcare providers are paid poor wages. I think the average wage of a child care worker right now is still under $12 an hour. So if you understand how this program works, it could quickly become more incentive for child care teachers to not work than to work. So where is the incentive for people to work during this crisis? And that's where your CCDBG dollars should begin to play into all of this. You can use those dollars to increase the pay of the people providing emergency care to frontline workers. And I think there's, well, we don't want to make recommendations. I just put it out there that there is some justification for that because these people are putting themselves at higher risk caring for children of people who are in a daily contact in some ways with people who have been exposed. So I think that that as childcare administrators and other people in government, this one is worth giving some thought to. There's two sides to this story. Yes, this unemployment compensation program, which essentially gives layers on top of state benefits, another $600 per week. So depending on the state benefits, that can be pretty appealing to people, and we have to be careful in thinking that through. Just a further note that one of the things Congress did with the unemployment, at least the pandemic unemployment assistance program, was to cover people who were not otherwise covered. And that includes all of family child care providers people, because under normal unemployment rules, family child care providers are self-employed and do not qualify for state unemployment compensation. So that was a good move on the part of Congress. And as is shown there, the faith-based employees as well. So those are things that we need to think through as we move forward with these programs, but keeping in mind the intersection between CCDBG funding and unemployment funding and this workforce that we need to care for frontline workers. So the final thing I just want to put on the table before we, talk about some of the implications of all of this is the Sick Leave and Family Leave Act that came in the first, second package actually that Congress passed. This is an interesting one now because so many of our programs are closed. It really does not impact a lot of people, but it could impact those programs that are still open. And in effect, if a worker does get sick or develop symptoms or is told to self-quarantine, they're out of work, this can be used to pay them sick leave. And how this works in effect is the organization pays the sick leave and then claims that what it costs them to pay sick leave for their employees against what they owe the government in taxes. So when they go to pay their quarterly taxes, they subtract what they paid in sick leave. In some cases, that's a wash. If there's not enough, if they don't owe enough, they can roll it forward and claim it in the next quarter. So it works out that this completely gets paid for in a tax offset. So keep that in mind for programs. It sometimes gets a little confusing for people to understand some of these things. And again, I just say we need to be giving these folks TA. As you can see on there, there's some provisions because many programs have fewer than 50 staff. There's some exemptions in the law as to whether or not these they pay some of this. So I would check with your state people on some of this, but also understand that these things are going to be a little bit difficult for people out there who are relatively unsophisticated business people to basically deal with this. As I said, or as the slide said, it's still a mixed jury or the jury's out on this one as to whether or not this is going to work for many childcare programs, but it is something that people need to know about if they are still operating in particular. So on the last slide, I just want to quickly put some things out there that these things are very complicated. The intersection of some of these programs can make a difference. There are strict requirements in these things about double dipping. So again, the TA that you provide to child care businesses is going to be very helpful to keep them, so they're aware of all of these things. Again, some of these, the issues and the requirements may become barriers for our people. It is complicated. And I tell you, for some of us who, and that includes myself, who's not schooled in some of this, takes a long time to think some of this through. So how do we begin to manage going forward? I think what we are concerned about here is that, you know, of all of these, there's no one size that fits all childcare programs. This is not easy because, as many of you on this call know, we have everything from small home-based to neighborhood childcare programs to the big chains. And so these things apply differently to different programs. And it's best that they go out and find the help that they need. I think as we move forward, we need to think about childcare, which programs, what affects centers versus family childcare programs, and how so. Why is it different? Why is it different? Another thing I want to put on the radar screen right now, because I do think that people out there are having these conversations or starting to. As the HHS staff showed you, that you can continue to be paying subsidy payments through your CCDF, but CCDF children, depending on the program, make up only a fraction of the income of those programs. And so the intersection between the child care subsidy, the subsidized children, and the private pay parents is what we really are going to have to think carefully about. And especially moving forward in keeping some of these programs viable is going to be problematic. So there are long-term and short-term implications of all of this. What we are hoping that we can start the conversation about our ability to begin to ramp back up the child care program and understanding the need as to how long it's going to take for people to come back into child care, for parents to really put their children back in formal child care. One thing I would close in telling you, two things I want to close that we learned from our survey. The first one is that of all of the things that parents are thinking about when they do return to work, about putting their children back in child care is the potential that their children could be exposed to the virus. And I think what we're going to have to do as in state governments and across this country is help parents understand the health and safety provisions that are already in place for childcare, that there are health and sanitation things that go well beyond what I think a lot of people understand in terms of hand washing and all of those types of things. We're going to have to really help parents understand some of this as they get closer to going back to work. The final thing I wanted to say to you that should be good news to people on this call that represent government, state governments. We did ask parents on the call if they were aware of state decisions around the COVID emergency and what was going on with childcare. And I think 75% of the parents said, yes, they were aware of how the state was doing. And the good news for all of you in states, and this is a very high number for a survey, is 82% of all parents said they were appreciated and approved and liked the way the state was handling the childcare issue as they were closing or opening or closing, et cetera. And I thought that was quite a compliment to state governments to get really high ratings like that. So I just wanted to put that on your plates, because I know as you all continue to move forward, these are tough times. It's really hard at the state level in these jobs. But I think the good news is at least parents are with you. So I'm going to close on that one and turn it back over to Beth.
Thank you so much, Linda. That was very valuable information. And thank you for your good insights and also feedback and information about that latest survey, because that's very helpful for us to hear. We've gotten a number of questions throughout the webinar, and I put up this slide early on in when I made the PowerPoint to remind you to use a Q&A box, but clearly you are all savvy enough and didn't need that reminder. So if you do notice that all of the questions have thus far been answered, we will leave this line open. So if people have a few extra questions, you have time to put those in and we can go through some of those. One of the questions I'd just like to make sure people know is that we will, as I said earlier, send out the recording We will also send out the slide deck. The HHS slides will go up on their website as well. I also just want to draw your attention to a couple of resources that we put out at NGA. The first one is a link to our childcare memo, which gives you a few, it's just a very short memo, but it gives you some highlights into what some of the states are trying and how they're thinking about some of these issues. And you can also, if you're one of the governor's advisor folks on this call, feel free to call us with any questions, email us at education@nga.org. We're also keeping a lot of COVID-19 related resources on our website, so check that out. It's updated daily. So let me turn back to my HHS colleagues and see if there are any of the questions that you particularly want to call out that you answered in one of the answer boxes, but that may warrant a larger discussion or note.
So Beth, this is Dawn, and I mean, I think most of the questions were fairly straightforward. I don't know that there's one in particular to call out, except maybe, I mean, so that we addressed this, but the question also came up just about paying a provider essentially twice, or can you pay the same provider if they're closed for the same child? And I mean, I think that's been a question we've been getting since the beginning. And I think I think there was some existing flexibility already in CCDF as far as states maybe using quality funds. We heard an example of one state who's basically doing what they're calling stabilization grants. And so they gave current providers a stabilization grant and to basically keep them, retain them, and then they might be paying another provider for that same child. So there was some existing flexibility already there with the quality dollars, and the CARES Act has just added more flexibility. So I think there's always a worry, I think, about double dipping or, you know, paying for the same service twice. And I think in general, that's a good thing to be worried about, but recognizing the need to stabilize the childcare market to some degree is really important. And so there's actually two tools in the toolbox for states to look at in trying to figure that scenario out.
Thank you, Dawn. And it looks like we did just get one more question. Can you pay essential workers directly, essentially giving them a voucher for childcare? And I don't know if that's one anyone's prepared to answer, but it's out there.
I mean, they would have to do some type of process. Like, I mean,
It's a state option though, don't you think, Dawn, that they would have to set it up that way?
yeah. I mean, I think there already are some states who basically give parents essentially like a debit card. There's a couple of states who use that model already. So it's more how the state has set its payment process up and how it's set its application process up in this situation for essential workers.
That's
So
good
Shannon,
to hear. I'm sorry. Go ahead,
I
Shannon.
have one comment. Can I say one? It's Shannon. I saw in there that there was a question about when the IM is going to go out, the guidance, and Rachel did answer that, but I think we need to do a little expectation setting about how thorough that is. I mean, this is a very flexible grant, and that IM goes over all the basic rules, but a lot of this flexibility that you're asking questions about, how might we handle it, is more likely to be found in our Q&A than the guidance. So I don't want people waiting for that guidance, assuming it's going to go into even as much detail that as we've discussed today. Rachel, do you want to add anything to that?
No, I think that's really helpful, Shannon. And the guidance is going to cover specifically the CCDF funds awarded through the CARES Act. And I think that there are a lot more questions that are broader and more nuanced that we are answering in our frequently asked questions that you can get right now from our website.
Mm-hmm. And some of these questions, oh, I'm sorry, Shannon, go ahead.
No, that was me,
No, what-
Beth. Linda. Can I just add one thing to this? And this is Linda Smith again. One of the things that we would like to know from all of you as you move forward about what does work and what doesn't work. And I think if you could share any of that with Beth or I or any of the folks on this call, it would be helpful, because I think back here, and especially with Congress on this one, they are trying to do the best they can to help this situation. And I think feedback is now what we need in terms of what works, what doesn't work. So that I think everyone on this call probably knows they're already starting to work on what they call 4.0 on this, the next version of something. And we really do need to understand what is not working from the state's perspective.
Thank you for that reminder, Linda. Yes, we would love to hear what you need, what's working, what's not. So please share that with us, any of us on this call. We also got a question about whether the Q&A will be shared out, and we'll need to sort of regroup and figure out the ACF questions will go into their larger FAQ document, but we'll take a look and see if there are any that are not captured in that we should think about sharing out more broadly as well. We did also just see a question on whether personal protective equipment can be purchased with CCDF funds the same way that cleaning supplies can be. And I don't know if that level of detail is been shared.
It's the same. You can use it that way.
Okay, there you go. That's an easy answer. The answer is yes. Makes sense. And then I think there's one other question about states creating plans for children whose main caregiver is not available to take care of them. Could that population be seen as needing protective services even though they're not in the child protection system?
Yes. Yeah. So there's the CCDF category, protective services, is not limited to the child protective system, and so parents who are essential workers, for example, and those children who need care, they could be defined in that category.
Thank you.
Don, do you want to say any more about how this isn't the same child protective services as child welfare and the Children's Bureau operates?
Yeah. So I mean, when CCDF talks about protective services, it's meant to be children who are in need of or at risk of needing protective services, but there's broad flexibility, and the regulations specifically say it's not limited to the child welfare definition of protective services. So, again, homeless families could get defined as needing protective services. In this case, it might be essential workers whose parents are at risk or who need to go to work, and the children need childcare, so those might get defined here. So there's a lot broader flexibility under CCDF than as far as what's considered protective services, and it's just important that the lead agencies tell us what that definition is in their plans.
Oh, this is the last question we just got was about recommendation for children wearing masks. And I don't think that comes out of HHS. I think all of those recommendations are from CDC, but correct me if I'm wrong.
You're not wrong. What I heard yesterday talking to some of the CDC people was that for children older than 2, if they were to wear masks, they would probably end up touching their face a lot more than they already do, and it probably would defeat the purpose. That was, but yeah. They're releasing some more guidance tomorrow that I think builds on what they put out 2 weeks ago, and that's probably going to be in there, something about the masks.
And anyone who works with young children knows cleaning faces and hands is going to be far more effective than trying to get them to behave differently by, keeping a mask on. If schools are providing childcare services for school-age children, can you support them with new CCDB funds for purchasing supplies, for example? So
this is Dawn, and I mean, I guess, so if I'm following the question, I know that some states have designated schools as temporary or emergency facilities, and so in essence, they're they're now considered childcare. So anything that you could have supported a childcare program, you could do the same thing, even if it's a school setting, because it's operating as a temporary or emergency childcare.
So the fact that the building happens to be a school is not really the relevant factor there, so,
Correct.
okay.
So Don, there's one more question, and I feel like we should not leave Brenda Sanchez question unanswered if there's any way we can answer it.
So we just answered that?
You
That's
did.
the one about the protective services?
Okay.
Yeah.
So you don't want to tell us what you said?
Well, no, it's the one I was just talking through about the protective services, and it's not limited to the child welfare definition. And so they would be able to put, you know, children, they would be able to define how they needed to in their state, you know, which families might fall into that category.
Okay, good.
Yeah, the question stays up there until we actually physically move it rather than answer it.
Then whether
Yeah.
heard it.
So see,
Okay.
other questions. Does anyone else have any last minute information they'd like to share with the group before we sign off? Oh, Linda, I think I accidentally muted you. So if you have anything else, just let me know.
Okay, no.
Okay, great. Well, thank you all so much. I appreciate not only all of the great information that you all have shared. I know this is a complicated area. I've been working in the early childhood field my entire career, and I learned a lot today. So I know that others must have learned a lot as well. There will likely be more questions that will come out of this, but hopefully we will all you know, work it out together. So thank you all for taking the time to share this information. Thank you for the participants who gave us great questions and helped us move this all forward. I think we need to commend ourselves for working really hard on a very complicated problem in a very difficult time. And I would like to just remind you all that we are all here to help at NGA, at ACF, at Bipartisan Policy Center, and lots of other folks out there as well. So call upon us as you need to. We're here to help. And we'll figure this all out together. And in the meantime, be on the lookout for the recording for this call and for the slides as well. So thank you all for joining us, and we wish you all a wonderful rest of your day.
Thank you, Beth.
Thank you, Beth.
Thank you.